Stanford students recently returned from a 7-week medical research trip to Mumbai, India, as part of the Stanford India Health Policy Initiative. Their task? To document on-the-ground realities of the Indian healthcare system and its pharmaceutical networks.
An important thing to know about the Stanford India Health Policy Initiative is that everything we do is really focused on priorities that come from India. And to elucidate these, we spend a lot of time with our partners in India really trying to understand in a deep way exactly what these are.
India's healthcare system is extremely underfunded and fragmented, with some very large obstacles. So the students hit the ground running, traveling to the slums to interview mothers in the so-called untouchable caste. The women talked about their struggles to get access to medicine and doctors. India has a wide array of practitioners with differing philosophies and varying levels of experience with specific problems. In addition to Western medicine, traditional medical practices are alive and well.
There's been this surge in lifestyle diseases like diabetes or hypertension in their patients in the past 10 or so years. And this has actually brought up a lot of issues for them because more traditional providers will have less training in this and less experience.
The students diligently interviewed both doctors and informal healthcare providers, coming away with some surprising insights.
So today I was talking to a homeopathic doctor, and he stopped in the middle of the interview. He said, "Let me give you an insight. The Indian healthcare system is better than the American healthcare system." And I was like, "Why?" And he said that in the American healthcare system, everyone's suing each other and all the doctors give too many tests and too many prescriptions. In the Indian healthcare system, they actually know how to diagnose people. And it really made me realize that we can't assume that the Indian healthcare system is necessarily worse than the American healthcare system in every respect.
So they're helping patients with
No generic, no subsidy.
Today when I was talking to an Ayurvedic doctor, I was actually surprised to see that he was offended when I asked him if he wrote prescriptions instead of dispensing medication. And I found out it was because he has a lot of poor patients who can't afford the medications when prescribed. And so he does his best to stock these and feels a moral obligation to give them these loose medications.
While visiting several pharmaceutical warehouses, the students investigated the way in which both doctors and informal healthcare providers obtain and dispense medicine.
India, there is a lot of humidity problem which comes across. So if you see this packing, it's a unique packing.
As the students gathered data about India's complicated pharmaceutical networks, they also studied the current policies and regulations.
For malaria, he said he had 3 to 4 patients a day with malaria.
The India Health Policy Initiative is in its 3rd year and looks forward to continuing its work on the ground to identify the obstacles that are preventing health policies and programs from reaching their full potential.
Another really important aspect of our summer projects is that we hope over time that collectively they'll really build up the experiential knowledge base of why health programs in India succeed or fail. And we think that a lot of times the key determinants of success or failure are things that you really have to see from the inside. You really have to get into the weeds a little bit. You have to understand practical realities. They're often not things that can be easily understood or even diagnosed using more traditional approaches.